Welcome to AMCI's 30 and 30, where AMCI instructors bring you 30 minutes of powerful, interactive instruction, followed by 30 minutes just for you to ask questions, get clarification, and deepen your understanding. This is a AMCI's way of opening direct access to our instructors, giving you the chance to learn, apply, and get real-time guidance from the experts. Your success is our focus, and AMCI 30 and 30 is here to help you code with confidence, accuracy, and skill. So get your coding manuals and get ready for your instruction. It begins now.
Hello coders, welcome back to another AMCI 3030 YouTube session. And today we are diving into an important topic in medical coding. Yes, maternity care and delivery safety coding. So whether you are a beginner coder brushing up on the basics or an experienced professional looking for a refresher, this session will give you practical tips, examples, and strategies to code with confidence. So grab your notes, stay focused, and let's get started with the maternity care and delivery coding. So the CPT codes for maternity care and delivery coding ranges from 59000 to 59899. Let's begin by reading the copyright. CPT Copyright 2025 American Medical Association, all rights reserved. CPC is a registered trademark of AAPC. AAPC content found within this presentation is a copyright of AAPC. Keyword concept FTR, CHON, AMCI Fab 7, AMCI ICD 10, Flip or Tap, and AMCG are the trademark of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. So the CPT codes for maternity care and delivery falls under the female genital system chapter in your surgery section. And if you look over here, you can find a lot of procedures, such as procedures on the vulva, vagina, cervix, uterus, ovary, oviduct, and the in vitro fertilization procedures as well. But today, we are going to focus on the vaginal delivery, antepartum and postpartum care CPT codes, cesarean delivery CPT codes, and the delivery after previous cesarean delivery codes. In uncomplicated cases, the maternity care is typically divided into three distinct phases. So we have the antepartum care, the delivery, and the postpartum care. And each phase comes with specific services and corresponding coding guidelines. So coders, first let's have a look into the antepartum care services. So this phase refers to the services provided to the patient before the delivery, right? And it generally includes the initial prenatal history, the physical examination, subsequent prenatal visits with the history and physical examination, and the routine measurements and assessment, such as the weight measurement, blood pressure, fetal heart tones, and even urine analysis. So the antepartum care includes a scheduled monthly visits until 28 weeks and the bi-weekly visits until 36 weeks, then the weekly visits until the delivery. Also, it is important to note that the pregnancy confirmation during the problem-oriented or a preventive visit is not considered the part of antepartum care, and that should be reported separately using appropriate E&M service. So if a patient comes with a non-pregnancy complaints or which is unrelated to the pregnancy, and the doctor finds out the patient is pregnant, and that visit should be coded with appropriate E&M service codes, and they are not included in the antepartum visits or antepartum care services. Okay, great. So now let's shift our attention to the delivery services. Now, the delivery services include the care provided to the patient during the hospital admission for the childbirth. So, during the delivery, a lot of complication may arise, and the coding should reflect them accurately. So, the medical complications of the pregnancy, such as diabetes, hypertension, cardiac problem, or even the preterm labor, can be reported separately. And the surgical complication during the pregnancy, like appendectomy or ovarian cyst removal, they are usually found and coded under the surgery section. Okay, so that's all with the delivery, and the delivery can be vaginal delivery as well as cesarean delivery. Now it's time for us to move on to the postpartum care. So, finally, the postpartum care refers to the medical attention provided to the mother after the delivery. And this phase includes a follow-up visits, the management of the recovery, also addressing any complication that may arise during the postpartum period. So together, these three phases, the antepartum, the delivery, and the postpartum, forms complete maternity care packages. And we will be discussing about the coding of these packages on the upcoming slides. So understanding how each phase is defined and coded is essential for accurate reporting and compliance. In our CPT manuals, we do have separate codes for the vaginal delivery services and the cesarean delivery services. The CPT code 59400, it represents the routine obstetric care including the antepartum care, vaginal delivery, and the postpartum care. And this is a global code for uncomplicated vaginal delivery. And this is also known as a vaginal package code because it includes all the three phases. It includes the antepartum care, it includes the vaginal delivery, and the postpartum care as well. And we also have CPT code 59409 that is for vaginal delivery only. So if the physician provides only vaginal delivery and doesn't provide the antepartum or the postpartum care, in such scenarios, we can use the code 59409. And CPT code 59410, that is for vaginal delivery, including the postpartum care. So 59410 doesn't include the antepartum care. And similar to the vaginal delivery codes, we have a package code for cesarean delivery as well. So cesarean package code is 59510, and that includes the routine obstetric care, including the antepartum, cesarean delivery, and the postpartum care. And the CPT code 59514 is for cesarean delivery only, and CPT code 59515 is for cesarean delivery with the postpartum care. We have an add-on code 59525 that is for a subtotal or a total hysterectomy after cesarean delivery. So one thing which you have to keep in mind is that when you use the 59525, which is an add-on code, you should use only with the cesarean delivery codes. Okay, great. Now you might be wondering, what CPT code should I assign for the physician who provides only the antepartum care or the postpartum care? And we do have separate codes for them as well. So CPT code here 59425 should be assigned when the physician only provides the antepartum care, and that is for 4 to 6 visits. And if it's 7 or more visits of antepartum care, you can assign CPT code 59426. And if the antepartum care is between 1 to 3 visits, you should use the appropriate E&M codes. So for 1 to 3 antepartum care visits, it is not included in the antepartum care section. And finally, we have a postpartum care only code as well. That is 59430. Now let's move into another important section in maternity care and delivery coding. That is the delivery after previous cesarean delivery. And the code series ranges from 59610 through 59622. So these are for the patients who have had a previous history or a previous cesarean delivery and now presents with the expectation of a vaginal delivery. So the final code assignment depends totally upon the outcome of the delivery. So here we have a VBAC, which is vaginal birth after cesarean code series from 59610 through 59614. And these codes are used when the patient with a history of cesarean delivery successfully delivers vaginally. Okay, and the CPT code 59610, it's a total maternity package as we seen previously. So this includes antepartum care, vaginal delivery after the cesarean, and the postpartum care. And next we have CPT code 59612, which is for vaginal delivery only following a previous cesarean delivery, and 59614, that's for a vaginal delivery and postpartum care following a previous cesarean delivery. So remember, with VBAC, we focus whether you are reporting the total package, delivery only, or delivery with postpartum. And next we have cesarean delivery after a previous cesarean delivery. And the code series are from 59618 through 59622. And these codes applies when the patient attempts a vaginal birth after a cesarean delivery and but ends up requiring a cesarean delivery. So similarly to the VBAC, we have a package code that is 59618, which includes the antepartum care, cesarean delivery after the attempted VBAC, and the postpartum care. And we also have CPT code 59620, that is a cesarean delivery only following a failed VBAC attempt, and CPT code 59622, that is for a cesarean delivery and the postpartum care following a failed VBAC attempt. So accurate coding depends on two major factors. Was a VBAC attempt successful or unsuccessful? And are you coding for a total maternity package, delivery, or delivery plus the postpartum care? And it is time for us to review the facts to remember, the FDRs for maternity care and delivery codes. So I have put out two tables over here for your easy reference, and you can use them if you want. So the key is to identify the type of delivery, whether it was a vaginal or a cesarean delivery, successful VBAC or a failed VBAC, and also whether you are coding for a total package, delivery only, or a delivery plus postpartum care. And we also have codes 59425 for antepartum care only for 4 to 6 visit, and 59426 for antepartum care only 7 or more visits. And if we have an antepartum care for 1 to 3 visits, you have to assign the E&M codes. And finally, CPT code 59430 for postpartum care only. So coders, make sure you know these FDRs. And coders, it is time for some coding exercise. So, are you ready to test your knowledge? I know you all are. So, let's go ahead and let's do the first scenario. Of the following answers, which best describe Dr. Smith's service? Option A 59622, option B 59614, option C 59410, option D 59515. A 28-year-old primigravida patient while on vacation presents to the hospital in active labor at 39-week gestation. After several hours of labor, the ED physician, Dr. Smith, performs cesarean delivery. The patient returns home and visits Dr. Smith, who provides routine postpartum care, including the follow up visits over the next 6 weeks to monitor the patient's recovery and address any concerns. Of the following, which best describe Dr. Smith's services and coders? You got 2 minutes to solve the scenario, and your time begins now. So that is 2 minutes, and I do see a lot of great answers in the chat. So, great job on the first scenario. Let's go ahead and let's break down this one together. So, let's get our inventory out. We have a cesarean delivery and a postpartum care given by Dr. Smith, who happens to be a ED physician and performed the cesarean delivery for the patient as patient was on her vacation, right? So it's clearly stated that he performed delivery and postpartum and not the antepartum care. Okay, now let's go ahead and let's look into our code options. CPT code 59622 is coding for a cesarean delivery only following attempted vaginal delivery after previous cesarean delivery, including the postpartum care. Okay, so this is coding for a failed VBAC procedure, right? And it is nowhere documented that there was an attempted vaginal delivery or patient had a previous cesarean delivery. And if you read the scenario, it's clearly mentioned that it is a 28-year-old primi gravida patient, right? So this is her first pregnancy. And that help us to rule out option A, 59622. Now let's look into the next code options. 59614 is for a vaginal delivery only after previous cesarean delivery, including postpartum care. So once again, this is a VBAC procedure, and we already determined that patient didn't had any previous cesarean delivery. So again, option B is also a wrong one. You're left with option C and option D. Option C, coding for 59410, and that is for a vaginal only delivery, including postpartum care. And from the documentation and inventory, I can see that we had a cesarean delivery and not a vaginal delivery. So option C is also incorrect. And that leaves us with the final code option, option D, which is for 59515, which is cesarean delivery only, including postpartum care. And that exactly reflects our inventory list. So option D, 59515, is the correct answer, as most of you have said. Great job. So let's move on to the next scenario. Excellent job. So if you have any doubt or need any clarification, you can place them in the chat. Okay, Chorus, let's go ahead and let's do the second scenario. Of the following answer, which best describe the Dr. Green's encounter? Option A, 59510, option B, 59610, option C, 59620, option D, 59618. Mrs. Isabella Rodriguez, 27-year-old pregnant patient with a prior cesarean delivery. She received all her routine antepartum care from Dr. Green and attempted vaginal delivery. However, after several hours of labor, the attempt was unsuccessful and Dr. Green performed a cesarean delivery. Dr. Green also provided all of Mrs. Rodriguez's postpartum care. Of the following, which best describe Dr. Green's encounter? And coders, your 2 minutes is going to start now. All the best. And that is time. So excellent answers. You all are rocking on this delivery CPT coding. Great job. Okay, coders, so let's look into our inventory list. We have a patient with previous cesarean delivery, and Dr. Green provided the antepartum care, unsuccessful VBAC, which means that there was an uh, attempt, attempted vaginal delivery after previous cesarean delivery, and that was unsuccessful, and it resulted in a cesarean delivery, right? Yes. And also we have a postpartum care that was provided by Dr. Green. So altogether, looking into my inventory list, I can see that this was a package service that was provided by Dr. Green. Yes. So keeping that in mind, let's start solving this scenario. Let's look into our code options. Option A is for 59510, and that is for routine obstetric care, including antepartum care, cesarean delivery, and postpartum care. So from the code language, it is clear that this is a direct or straightforward cesarean delivery package code. And we are looking for an unsuccessful feedback followed by a cesarean delivery package service. So option A is incorrect. You have to go. Option B, coding for 59610, that is for a VBAC procedure. And I can see from in our inventory list that we had an unsuccessful VBAC. So this is not going to be a VBAC procedure. So I don't need to go ahead and read the code language because this churning is going to help me, or it is helping me a lot. So option B is also incorrect. Option C, coding for 59620, that is for a cesarean delivery only following attempted vaginal delivery after previous cesarean delivery. So this code might looks like a good one, but it is still an incorrect code because this is not coding for a package service. And it was clear, as I said in the beginning, we are looking for a package service, and 59620 is only coding for a cesarean delivery. So option C also have to go. And the last remaining code, which is going to be the correct answer for this scenario, it is 59618, which is coding for routine obstetric care, including antepartum care, cesarean delivery, and postpartum care following attempted vaginal delivery after the previous cesarean delivery. So it covers your antepartum care, it covers a cesarean delivery following an unsuccessful VBAC. Also, it covers for a postpartum care. And this is a package code. So your correct answer is option D, 59618. Amazing coders. You all have rocked throughout this delivery coding section. So great job, and you have done a great work.